Before I start, I will make sure my environment is safe for me and for my patient. I will ensure privacy and confidentiality by closing the curtains and closing the doors. I will do my hand rub before approaching the patient, so that palm to palm, back of the hands with fingers interlaced. Palm to palm with fingers interlaced. Fingers interlocked. Rotational rubbing of the thumbs. Tips of my fingers to the opposite palm. And my wrist. So I'm now ready to approach my patient. Hello, good afternoon. My name is Ara. I'll be your nurse today. Can you state your full name and your date of birth, please?
It's Anthony James, date of birth 26/9/1989.
Alright, so what would you like me to call you?
You can call me Anthony.
So Anthony, is it alright if I double check the information on your wristband?
Oh, sure, yes.
Okay. So that's Anthony James, date of birth 26/9/1989, hospital number 986-30387. So Anthony, do you have any allergies?
Oh, no, nothing.
No allergies, so that's correct. It's the same with my records, and I can see that you also have a white wristband, so it matches with my record. So Anthony, I'm here today because I need to administer your Novorapid insulin injection for 1800. Is that okay?
Yes.
Have you taken this medication before?
Oh, yes, yes.
Okay, so I can see that it is your regular medication to control your blood sugar levels.
Yes.
So before I do the preparation for this medication, I just wanted to know if your blood sugar has been checked.
Yes, it's been normal, they said.
Okay, so examiner, is my patient's blood sugar normal? Okay, so I also wanted to know if you have taken your dinner. You have taken
I just had my lunch, so I think it's the right time.
Okay, that's fine then. So I can now proceed to prepare your medications. I will be in the treatment room to prepare the medication, but if just in case you need any help, you can press the bell and somebody will help you.
Okay.
Alright?
Thank you.
So leaving my patient, I will make sure that I do another hand rub. So palm to palm, fingers interlaced. Palm to palm with fingers interlaced. Fingers interlocked. Rotational rubbing of the thumbs. Fingertips to the opposite palm, vice versa, and my wrist. Before I start preparing, I will ensure that my prescription is valid. So it's Anthony James, 26/9/1989, hospital number 986-30387. So that's Novorapid 8 units, once a day at 1800 hours. My prescriber signature and lead number is indicated in my drug chart as well. So that's Dr. Simi and lead number 1234. So once I have ensured that my prescription is valid, I will now proceed to preparing my medication. So since I know that this medication is an insulin and it's used to treat my patient's diabetes, I don't have to check the BNF anymore, but just in case I'm not sure of anything about the medication, I will make sure that I will use the BNF. So moving on to preparing my medication, I will ensure that I have a clean tray.
The tray is clean, you can proceed.
Alright, thank you, examiner. I would need my medication vial, so ensure that it is the same with my prescription. So this is Novorapid 8 units. So Novorapid expiration date is 5th of 2020, and I also need to inspect if it's a new vial, multi-dose vial. So since it's new and newly opened, there are no precipitates and discoloration on my vial, so it's good to use. So I also need an insulin syringe. So my insulin syringe is intact and good for use and will expire on 2020. I also need some Sani wipes, intact and will expire on 2020. Of course, I have my gloves and my apron ready for me to use. So before I start preparing, I will ensure that I will do another hand rub. Palm to palm. Back of the hands with fingers interlaced. Palm to palm with finger interlaced. Fingers interlocked. Rotational rubbing of the thumbs. Tips of the fingers to the opposite palm and vice versa in my wrists. Okay, so before I aspirate my medication, I need to make sure that I clean the top of the vial for 30 seconds. 1, 2, 3.
Consider 30
4.
seconds and proceed.
Thank you, examiner. So assuming it's already 30 seconds, I will wait for another 30 seconds to let it dry. 1, 2, and dispose of this in the clinical waste. 5,
Consider
6.
30 seconds.
Okay, it's 30 seconds. So my vial is dry. I will now aspirate the desired dose, so that's 8 units. So making sure that I get the appropriate amount of 8 units. Okay, and then by one hand scooping method, I will resheath my needle. And I will now expel air bubbles and ensure that I have the correct dose. So, examiner, can you please verify if
That's
it's
correct. Proceed.
Okay, thank you very much. So I will need this, and I might need some extra gauze. Examiner, I don't have any more gauze. Is it okay if I get an extra one? But if, while my examiner is getting an extra gauze, I will dispose this.
Okay, you
Thank
can
you
have
very
this.
much.
Thank
So
you.
ensure that my gauze is within date as well, 2022. Okay, I prepared my medication. I will wear my apron. And if there is a sink, ideally before I administer the medication, I will do a hand washing before I inject the medication. But I will, since there is no sink, I will do a hand rub. Palm to palm. Back of the hands with fingers interlaced. Palm to palm with fingers interlaced. Fingers interlocked. Rotational rubbing of the thumbs. Fingertips to the opposite palm, vice versa, and my wrist. So I will wear my gloves. So bring my tray, my prescription, and if it is a portable sharp spin, I will bring it with me as well. So Tony, I'm back to administer your medication. Are you comfortable with your position?
Yes, I am.
Okay, so before I administer the medication, I just want to know where it was given yesterday.
It was on my right side, on the
On-
abdomen.
On your right abdomen.
Yes.
So today I will be injecting it on your left abdomen. As you know, it's really important for us to rotate the site.
Yes,
Okay?
thank you.
So before I inject and assess the site, I just want to verify your details again. So can you state your full name and your date of birth?
Yeah, it's Anthony James, 26/9/89.
Okay, and do you have any allergies?
No.
Okay, is it alright if I verify on your wristband?
Yes, please.
So that's Anthony James, 26th of the 9th, 1989, hospital number 986-30387, and I can see you have a white wristband, meaning you don't have any allergies. Okay, so I will now expose your left abdomen. Is that okay?
Yes, thank you.
Okay, so ensuring dignity for my patient at all times, so I just need to expose the left thigh. So left abdomen, I mean. So I will ensure that I will assess the area if there is redness or inflammation. So I am happy to administer it in this site since there is no redness or any inflammation on my skin. Okay, so Tony, before I inject the medication, I will clean my site. If the area is visibly clean, I don't have to clean, but in this case, I will clean the patient's abdomen. So rotational motion in 30 seconds. 1, 2, 3, 4. Okay, thank you, examiner. So assuming it's already 30 seconds, I will ensure to let it dry for another 30 seconds. So I will take my gauze ready for me after I inject. So I will take my insulin syringe. So I will make sure that I will inject the medication at a 90-degree angle because this is insulin. If it's any other medication via subcutaneous, it will be injected at a 45-degree angle. So remove my sheath and make sure to pinch the skin at a 90-degree angle. Tony, I will inject the medication now. So take a deep breath, a 90-degree angle, inject the medication. Okay, so inject the medicine at a rate of 10 to 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And I will put my gauze and remove the needle rapidly and discard directly to the sharp spit. And I will apply gentle pressure, but I will not massage. So Tony, Anthony, are you feeling okay?
Yes, I am.
Okay. So I have administered your insulin medication. So I will cover my patient right away, ensuring privacy and dignity at all times. And I will dispose everything in the clinical waste, including my gloves and my apron. So I'm ready to document. And do another hand rub since I removed my gloves. So palm to palm, back of the hands with fingers interlaced, palm to palm with fingers interlaced, fingers interlocked. Rotational rubbing of the thumbs, tips of the fingers to the opposite palm, and my wrist. So Tony, I'm just here. I will just document the administration. So I will sign my name and the date today and what time I have administered the medication, and I will also include the batch number. Batch number 726354 and subcutaneous be given on the left abdomen. Okay, so I have completed my documentation. Tony, I just want to ensure before I leave you, you're comfortable in your position.
Yes.
Okay, so side effects for this medication, as you know, it will decrease your blood sugar levels. So I would suggest you have something to eat. Since you have your dinner, just ensure that some food is readily available or drink is readily available for you because you might have hypoglycemia. But since you have taken your food and then you have your blood sugar checked, it will be okay.
Okay.
So if you have any concerns or you need any help with anything, this is your call bell. Please do press the orange button if you need anything.
All right, thank you.
So I will leave my patient now, ensuring that my tray is clean. So since this is a multi-dose vial, it can be used within 28 days. So I need to keep it in the fridge ready for the next use. So I will now take my short spin and my tray to get it ready for the next use to the treatment.